Okay, chapter 50, I think, is the last in the antimicrobial series, if you will, and it's a little bit of a hodgepodge of different topics that I nevertheless thought it would be worthwhile to discuss. We talked about metronidazole earlier in the class, I think, but specifically, since it doesn't really fall into any of the other categories we've discussed, metronidazole is mainly used in the treatment of Clostridium difficile infection, as well as the treatment of some protozoal infections, such as trichomoniasis. It is believed to have what is called a disulfiram-like effect, meaning that it acts similarly to disulfiram. Disulfiram is a drug that is sometimes used in the treatment of alcohol abuse because it um, blocks the enzymatic degradation of alcohol and produces a buildup of glutaraldehyde, which it causes a bunch of unsavory symptoms like flushing and nausea, etc. And so it's used to kind of encourage people who are alcoholics to not drink while taking the drug because they will experience these side effects. Similarly, metronidazole can do that. So people are told not to drink alcohol um, while on metronidazole. Mupirocin is something that is used most commonly in the treatment of methicillin susceptible or methicillin resistant Staph aureus. And it can be used most commonly in an ointment form for topical infections. A topical infection with staph is something that happens in kids most often and is called impetigo. It kind of produces a red, angry looking rash. In the perioperative area, you may see mupirocin because um, one thing that hospitals like to do is to get a handle on what patients are harboring methicillin-resistant Staph aureus, and the most common places for that to be hiding out is in the nose or the GI tract. So people often will do nasal swabs of patients coming into the hospital to see if they are MRSA positive or negative. And if a patient comes into the hospital MRSA positive, um, then uh, so be it. But if the patient comes in MRSA negative and leaves the hospital MRSA positive, then it suggests that there's been some nosocomial transmission of MRSA. Because MRSA um, can cause complications, there are some places where if a patient is going to be having open heart surgery, for example, and the patient tests positive for MRSA in a nasal swab, some places will use mupirocin ointment preoperatively to eliminate nasal carriage of MRSA. So that is a place where you may see mupirocin. Polymyxins are a category of um, antimicrobial that are they act by disrupting bacterial cell membranes, and they are so nephrotoxic that they are not used orally, but they're used again as topical. Nitrofurantoin and the methenamines, methenamine mandalate and methenamine hippurate, are drugs that can be taken orally, but essentially have no activity until they're excreted in the kidney and reach the urinary tract, and they're used to reduce bacterial load in the urinary tract. Just something to note about these three categories of agents. There are in healthcare, in order to sterilize instruments, to um, disinfect bacteria surface equipment like our ultrasound handles and the operating room table, etc. There are essentially three categories of agents used: disinfectants, antiseptics, and sterilants. And I just want to have you be exposed to the differences between those three categories of agents. So disinfectants are agents that inhibit or kill microorganisms. And they can do so through chemical reactions or through the just physical elimination of bacteria. Antiseptics are disinfectants that are um, are not so caustic that they can't be used on human tissue, so that antiseptic is something that can actually be used on the skin or used as a wound irrigant, etc. And then there's a sterilant, which is even more powerful than a disinfectant because not only does it kill bacteria and viruses, but it also is effective against spores, which requires more powerful conditions than disinfectants can allow. So some examples of uh, these types of agents. So in terms of disinfectants, uh, alcohol is one of the earliest used disinfectants. Alcohols act by disrupting proteins. And then there are the iodine-containing compounds, which were used as a skin antiseptic in the operating room for many years. But for reasons mainly involving allergic reactions, iodine-containing solutions have largely been replaced by chlorhexidine, which is often used in combination with alcohol as a surgical skin prep, and it is most powerful against gram-positive organisms, which are the ones that are most common on the skin surface, but also has some activity against gram-negatives and viruses. It's not so great at killing spores, but it has some activity against spores as well. Then chlorine and the so-called quaternary ammonia compounds are disinfectants that are too caustic to be used on the skin. So they are used only on surfaces. Interestingly, both of these agents are not active in the presence of large quantities of blood because the proteins in the blood inactivate these compounds. So they're meant to be used on surfaces, but not surfaces that are grossly contaminated with body fluids. The phenols are also too caustic to be used on the skin, but they're used to disinfect surfaces. And then there's the sterilants, which are really used mainly in the sterilization of surgical instruments, which are going to be used from patient to patient. So in that context, you want agents that can not only get rid of surface microorganisms, but can also kill spores.